What is preventive health? Fundamentally, it's anything designed to stop a health problem before it gets expensive, either by preventing it from occurring or by catching it early when it's cheaper to treat. And it's a really appealing idea. We all know the old saying about an ounce of prevention being worth a pound of cure. But in healthcare, that's just not always true. Any preventive program, by its nature, is going to involve targeting a lot of healthy people in order to reach that one person who would otherwise have gotten sick. The trick is to limit the number of healthy people that you have to treat. And if you can't minimize that, your program's not going to be a very good one. Think about a really straightforward form of preventive health, like cancer screenings. Obviously, there's an economic problem, because if you have to screen hundreds of thousands of people, the costs really add up. But it's not just about the expense. A lot of forms of screening carry risks of their own. So the more people you have to screen, the more likely you are to see problems from things like radiation. The more likely you are to see false positives, which cause people unnecessary stress, which is not good for health. A big problem is overdiagnosis, which is where you detect an instance of cancer that never would have caused the patient any problems if you'd left it alone. By medicating people in those cases, you can subject them to some very serious side effects. Nowadays, when people talk about preventive health, they usually mean problems like obesity or physical inactivity. They're talking about government funding for weight loss programs, or there's a medical school professor here in Australia who wants to make it illegal for workers to sit for more than 2 hours at a stretch because sitting is the new smoking. But a problem like obesity is much harder to get right, even than something straightforward like a cancer screening, because there's so much more uncertainty. There's uncertainty on the illness side, because lots of people who are overweight will never develop any obesity-related illnesses. But there's even more uncertainty on the treatment side. There just isn't a government program that can cure obesity. People who want to lose weight can be given help to do that, and there are about 1,000 programs on the market designed just for that purpose. But people who don't want to lose weight, the obese hardcore, the government can't force them to go to the gym. People keep hearing preventive health saves money. The purpose of this paper is to give voters and policymakers a toolkit to help them figure out when that's really true. You can download the full report at cis.org.au.